Good evening, greetings, and welcome to the monthly COVID-19 webinar series hosted by the 2nd District of the Psi Phi Fraternity Incorporated. As always, I've been your host. It's my pleasure. Now, as the immediate past, that's right, brothers understand, no past like immediate past. 2nd District representative of the mighty 2nd District, Kelvin Ampofo. It's an honor and it's a pleasure. As always, we bring this monthly webinar to you, the brothers, you, the family and friends of the brothers, and our communities, so that we're all updated, we're all made aware of what's going on with this virus, yes, that we are still dealing with, this COVID-19 pandemic. So I'm going to be moving around a lot tonight, so forgive me in advance, but you all know everything that you hear tonight, the words and comments that are expressed, does not necessarily reflect the views and opinions of the Psi Phi Fraternity Incorporated. The opinions that you hear are of their own brothers that make these comments. So please don't hold it against them. Now, as you all know, our esteemed, our distinguished 4 horsemen of the 2nd District, Dr. Keith Boykin, we call him 1978, he always brings us that knowledge. 1988, Dr. Jedan Phillips, he was at the epicenter when this all began, always gives us live and direct information as it relates to his patients. 91, Cedric, Guyton, always from a federal perspective, letting us know what's happening, and these brothers give it to us straight. We know our other brother, Wonzie, Gardner, he's holding it down, always being called away to business, but we also keep him in our thoughts and our prayers as well. So, Brother Horseman, it's good to see y'all. Let me say, it's the month of June, so certainly to all of you all, I hope you had a wonderful Father's Day. Happy Father's Day to all the men that are watching. You know, somebody told me a joke. They said, you know, when Mother's Day comes around, you can't get into a restaurant. But when it's Father's Day, you can just walk right in. I mean, I didn't feel some kind of way. I said, listen, moms is moms. We're going to make sure moms are taken care of. You know, the dads, they just make sure we got a tie or a grill or whatever the case may be. But at any rate, brothers, it's so good to see y'all. Dr. Boykin, 78, please start us off with that good stuff. Good to see you, my brother.
Well, good evening, everyone, and I'm glad to be here, and I'm glad to see you back one here, and certainly to our immediate past district representative, Brother Ampofo. It is a pleasure to have you back doing what you do. So, I'm just going to do a little slightly different than I normally do tonight. I got some things written down I want to tell you, but I want to first off start out with this thought. You know, everybody's worried about, well, I shouldn't say worried about, everybody's focusing on the decision the Supreme Court's making right now. That seems to be distracting people from other things they need to be paying attention to, as well as the January the 6th hearings. And all this is going around, people are forgetting to practice some basic, safe precautions. You know, we had gotten to a place where we were flattening out things with this COVID-19 virus. But now, you know, since about 2 weeks ago, we started to see a slight uptick in cases. That's right. Right now, we're standing at about 86 million cases, a little over 86 million cases, I should say. And a daily average of new cases has increased by about 7,000. So we have increased of about 1.3 million overall in terms of cases of COVID. So COVID's not going anywhere, y'all. Deaths, you know, we talked about this sad statistic of getting over 1 million deaths. And that's also increased in the last 2 weeks about 4,000, and increased about 31 average daily cases of death. So we cannot let the political landscape distract us from what we need to do. COVID is still out there and it's sticking behind us. You know, and I say that because, you know, people are also not listening to what they're telling us. The Omicron variant. Yes, the Omicron variant is still out there, and there's one sneaky little jive. You know what I'm saying? You know, the original BA.1.1.59, the original Omicron variant is still out there, less than 0% circulation. And then the variant of that, the BA.1.1 is out there still. They're not causing significant amount of diseases, but they still are variants of concern. So don't get lulled by the fact that you're not hearing nothing about them. And then the BA 2 still out there, 5.7%. But the big news right now is that the BA 1.12.1, which originated in New York, is still up there, but BA.5 is catching up to it very, very rapidly. That right now, BA.5 is 36.6%, as opposed to 42% of the BA 1.12.1. And then the BA4 right behind it at 15.7%. And what's the significance of BA.5 and BA.4? Well, those jokers have figured out ways to evade the antibody response. So that means everybody running around thinking that, okay, I've had COVID, I ain't got to worry about it no more. Well, guess what? BA.4 and BA.5 gonna fool you. Even people that have been vaccinated, because it can evade the antibody response. And Delta's still out there, not circulating, but it's still a virus being monitored. Now, I said all that as well to say this: vaccinations are just not going where they need to be. Right now, in the last 2 weeks, there has been no significant change in people getting their first dose, no significant change being fully vaccinated, no significant change in getting the first booster. And everybody should be getting the first booster, because now the CDC is considering that, getting the first booster or being eligible for the first booster is the new definition of being fully vaccinated. So that means that you complete your primary series and now you're eligible for the first booster. So that's what you need to be thinking about. Now, that's really important as we begin to think about going places this summer. And in our organization, we're having a big conference coming up. We call our conclave in just about 3 weeks. So people need to be started thinking about that as well. And then the second booster, that's for people over 50, if you have underlying medical problems, or definitely for everybody over 65. And we've only had a slight increase in those greater than 65, greater than equal to 65 getting the booster. Now, the African American rates are still lag behind. And as a group, though, there's only slight improvement. Now, I want to specify something that, we need to just take in consideration. When you look at the rates, they say, well, African Americans doing pretty well, like maybe 46.3%, 48.7%. Well, that's as a group in and of itself of people, that particular group being vaccinated. But when you take the whole population of people that have been fully vaccinated and take those numbers, then, we still, when we drill down to ethnicity, we take all the ethnicities and the other groups out there, we're still in the 10 percentiles. So, we really need to take a look at that fact. Say, for instance, there may be 73 million people out there. When you drill down to all those different ethnicities of that particular 73 million people that have been vaccinated, still only about 10% of African Americans either being first dose, fully vaccinated, or even considering the booster. Only about 43% of African Americans that are eligible for the booster are getting the booster. So as you get ready for the summer, don't be caught about it. Take a look at what's going on. The slight little increase in cases might be the thing that just sets you back when it comes to the fall. Now, we know since we last met, there have been 4 new vaccines. I call them 4 new vaccines that have been come to market, have been approved on the emergency use authorization. The first one everybody's been waiting for a long time was the 6 months to 4-year-old in the case of Moderna. I'm sorry, Pfizer, and the 6 months to 5-year-old in the case of Moderna. Now, another new adult vaccine out there is called Novavax has come to light. Now, that vaccine has been 2 years in the making. So all those people out there say they were afraid of the mRNA vaccines because they were so quick to be introduced to the general population. We can now put it to rest with the Novavax vaccine, because that's been 2 years in the making, kind of following the conventional guidelines as we go along with that. So, the new vaccine for Moderna is 2. The vaccine for 6 months to 4-year-olds, and then the Moderna 6 months to 5-year-olds. And then the Moderna vaccine for 6 to 17-year-olds has also been approved on emergency use authorization. And then, of course, the only booster you can get for the Moderna vaccine if you're 18 years of age. Now, the Pfizer vaccine, by the way, the Moderna vaccine is a 2-dose vaccine for 6 months to 4-year-olds, whereas the Pfizer one that was approved for that age group is a 3-dose series. So you have to consider, do you want to get 3 doses or do you want to get 2 doses? Now, we'll tell you that Side effects are pretty minuscule, probably about the same as you would see with any of the other pediatric vaccines, but slightly more with Moderna. And I experienced that myself with my Moderna vaccine as opposed to people who got the Pfizer vaccine. I probably had for the first 2 times a little bit more side effects in terms of soreness and pain and fever and flu-like symptoms and other. But the third and fourth one, they were a breeze. So that's the 4 vaccines that we talked about, and things we need to consider. People still running around afraid to get vaccinated, but the long-term effects of getting COVID disease in itself are unpredictable. We don't know which kid is going to get long-term COVID. We don't know which adult's going to get long-term COVID. So these are things to consider, seriously consider. And for the brothers that are thinking about going to the conclave, it's simply a matter of making a preparation. We need to look at the transmission rates in the community. And there's been broken down into 3 different areas. And I won't get into those at this particular point, but, low is green, moderate is yellow, and high risk is red. And you should plan your travel according to that. It doesn't mean because you fall into a high risk group that you can't go anywhere. You just got to make sure that you're wearing your mask. And we always talk about. So I'm going to pause at that point, brother IPDR, and I'm going to yield back the floor to you and the rest of the horsemen.
I mean, as always, Dr. Boykin, man, we appreciate you. I mean, you just dropped knowledge. It's crazy. 88. Talk to the people, man. What's good? What's happening with this thing?
Hey, what's good? Let me give you a little story. So last week I did a COVID podcast for a community group out in California, and a majority of the people on the call were not aware of the COVID oral antiviral therapy. So what is that telling me? That's telling me that, unfortunately, with all of the work that I think we have done, we still have a lot more to do. We have individuals that don't know what to do once they are diagnosed. And what that means is not only how long do I quarantine, but it also means what can I take to help me? At what point should I be concerned? All of these different things matter. And unfortunately, what we're seeing is, in spite of this being over 2 years of dealing with this, we still have some individuals that are working from square one. And to just echo what Dr. Boykin just said, in our community, we've got a 10% vaccination rate. So again, we are still the low-hanging fruit. I'm still seeing people in the office. Actually, I'm at work still now. I'm still seeing people in the office come in with COVID. Now, fortunately, as I've said throughout our times of meeting, for the people that are vaccinated and current with their vaccination, as Dr. Boykin just made an important point of noting that, I'm still seeing them have milder COVID presentations. I'm still seeing that they're avoiding hospitalizations. However, I recently did have a patient who was not up to date with their booster shots as it was recommended for their age group. And unfortunately, they contracted COVID while traveling to Florida, and they got hospitalized, ICU in Florida, and they just had to be transferred to New York. Now, this was someone who thought, I got my 2 shots, back when they were offered, and I'm not doing anything more than that. But as Dr. Boykin just said, the Omicron bros, as I call them, are not playing. They are very, very aggressive, and they are looking for vulnerability. Vulnerability comes in the forms of not being fully vaccinated. Vulnerability also comes in the form of not protecting yourself when you may be in situations that might not be safe, meaning I'm up in somebody else's face, meaning I'm in an indoor setting. And to be quite honest with you, I still am one of the people that people call, just like probably Dr. Boykin and Dr. Guyton, when they get sick. And I find the calls that I'm getting now are coming after events. Hey, I was just at this event and everybody that was in my group got COVID. So it just speaks to how aggressive this COVID variant that is currently emerging is right now. And as we approach our conclave, because, again, a 10% vaccination rate gives a great opportunity of vulnerability. I would say as you got 3 weeks, if you haven't completed your primary series or started, get your first shot. If you're due a booster, get that booster now. If you haven't gotten your second booster and you qualify, get that second booster. Because unfortunately, we are about to go down to North Carolina, and unfortunately, a lot of folks, and I may be one of them. Once we get in that moment, it's hard to control yourself. So the one thing that's important is recognizing, as Dr. Boykin said, where am I traveling from to, and looking at the incidents in those areas, and making sure that when it's appropriate that I'm utilizing the protective measures such as a mask. Because again, COVID is still out here and it can still cause a whole lot of trouble. And the other conversation that I've been having in the office is with my patients that have young children. Am I going to get my child vaccinated? I just had a patient come in today who's got young children and hasn't gotten them vaccinated, and she just got a new job. I says, well, are you prepared to possibly miss some work? Because again, they're going to be going back to school, and that is a hotbed for opportunity for COVID to start to run rampant. So with all of that being said, I think that, we've got a lot to talk about this. We've got a lot to think about. And with that, I'll yield my time to my brother, Dr. Guyton.
91, talk to us.
Brothers, it's truly an honor to be here. I truly miss this forum as we're still battling with the fatigue of coronavirus on all our communities. Just to give you some of the analogy of what we're dealing with as a country, we have over 85 million infections. The next closest country to us only has 43 million, and that is India. We are not doing an effective job of preventing the infections and preventing our communities from being infected or getting our community vaccinated. So you say, what are you saying, Cedric? We hear the statistics. What we have to do is realize we can't get fatigued. We have to be vigilant. I've traveled to a number of conferences, even Omega conferences and in public health conferences and working. There's not been one conference I haven't been to where we haven't had an infection. And what we have to realize is that coronavirus isn't going anywhere. And the thing that has prevented millions and millions of deaths, as the CDC reported a couple of weeks ago, have been our vaccines. There is not a question about, does a vaccine work? Yes, they work. They will prevent, once you're fully vaccinated, your hospitalization and death. I've dealt with my mother. I've dealt with my brothers being sick, but they're all fully vaccinated. Let's talk about the paradigm of when we travel. How do we travel, and what do we do to prepare? Now, instead of picking up and grabbing your socks and make sure you got a nice suit, you need to verify the numbers in the areas that you're going in. You need to make sure you have a mask. Let me say to you, I've been on 4 planes in the last month traveling, and I can tell you on one hand, maybe 5 to 10 people had a mask on that plane. I encourage you to continue to wear your mask in small confined places. Because in a room of 2,000, 3,000, in a convention, we still have 8 or 9 people who come out COVID positive. I had around me in a general area, 5 of my colleagues get sick. I did not. And it goes back to washing your hand, hygiene, having a mask on, and distancing, because I travel paranoid. And I hate to say that. I travel paranoid because I don't want to get fatigued knowing what I've seen my friends, colleagues go through being sick. So I have to stay vigilant, because I know I can't get sick. I have too many people relying on me to be there. And that adds, again, to that mental fatigue that we all are experiencing with COVID. Let's stay vigilant. Now, let's talk about treatment. Now, there has been some backdrop in stories on the new Paxlovid, which is a 5-day oral treatment for the coronavirus. It's the same medication that Dr. Fauci. Yeah, Dr. Fauci, finally, he did catch COVID. He is fine, but he used a 5-day treatment. One of the unique things we're finding about COVID is that there is what we're seeing is a rebound COVID effect after taking his medication. You know, he may have taken the medication 5 days. He tested fine after taking the medication, but 2 or 3 days after he tested fine negative, he had a positive test because he was feeling bad. We're finding that COVID rebounds before it dissipates, which is a phenomenon that we're studying now. But peroxamid is an effective treatment. If you notice that in some patients that take the medication, if they have a positive test after testing negative, that has happened. And we are working to find out why. That's why it's uniquely important that you stay vaccinated, that you stay vigilant. And with the fall coming up, the winter, you're like, well, we just started summer. You know, as an epidemiologist, you have to think ahead, population health ahead. We need to look at how Omicron is going to impact us. There is talk of another booster. There's talk that that booster may be focused on the specific variant that is going to be coming out. That research is ongoing now with Pfizer and the others. And Omicron is that variant that they're worried about the most. Omicron is still around. For instance, if we're going to North Carolina, I'm looking at the numbers. There are 3,000 cases a day here in Virginia. It's less than 300 a day down in North Carolina. You can even break that down to the county. I've been looking at those numbers ever since I started having to follow it for my teams. The other thing, if you're traveling internationally, I just sent my daughter to Greece, just sent my daughter to Germany. I watch the numbers every day. I make sure she's ready. She has masks, and she understands the importance of being fully vaccinated. She's fully vaccinated. But we must stay vigilant. We must clearly understand that we still have a invisible enemy that's attacking us. Our community, our African-American community especially, need to get vaccinated. With all the underlying conditions, all the socioeconomic issues that we have with getting health care and sustainable, affordable health care, we need to be very vigilant. If you're not insured, it is going to be a lot harder in the future to get vaccinated for free or to even get tests for free. So while we are able, let's continue, brothers, to push our communities to get vaccinated. It's the best avenue to protect life and livelihood and our families. I'll hand it back to Media Pass DR.
I think he probably stepped away, so I'll just take over there. So you said some very important points, Brother Guyton, particularly about the having to pay for the vaccine, because we now know that Moderna and Pfizer have been fully approved. That means they now have a trade name, Spikevax and Comirnaty. I can't remember the exact name. So that means people have, practices have the right to charge for that now because they have a trade name. But I think they're holding off on that because we're still in a pandemic state. So people, are not too crazy. Everybody says Big Pharma does this, Big Pharma does that. But I don't really see any evidence. Maybe Dr. Phillips or you may see some difference. But from what I can tell, that nobody's charging for the vaccine yet. They can always, and being a person that's worked in vaccinating people for years, they can always charge you an administrative fee. Not for the vaccine. It's an administrative fee. So people think about that. As you said, as time goes on, no longer can use the loose excuse that, if I get corona, I'm not have to be vaccinated. Because as Dr. Guyton and Dr. Phillips both said, this rebound phenomenon, this reinfection rate is pretty significant. So you're going to get COVID at some point in time. But the good news is that if you were vaccinated and you had disease, you have a much better chance of having longer-term antibodies than just getting disease alone. And in the case of pediatrics, the question always comes up, should I get my kid vaccinated? Well, the answer is yes, because we don't know which kid's going to get really sick from Omicron, which kid is going to get long-term COVID from Omicron, and which kid may die from Omicron. Yes, there have been children that have died from Omicron infection. So I'm telling you, if you have young children and you're going to the clave, just remember, you can bring that back to your children and infect them. Or if you have young children that are infected, you can take that to the clave. So, brothers, we got to prepare for this. We have really got to prepare for the conclave. I know a lot of brothers are hesitant about going to the conclave, and I understand that. There are probably many brothers out there that don't want to get vaccinated, and I understand that. But if you really want to go to the clave and do the work of Omega, have a plan. Have a plan. You know, Dr. Phillips and I and Dr. Guyton, and all of us have talked about this, you know, since the beginning of this, since treatment started rolling out and since vaccines started rolling out, we talked about having a plan. Have a plan. You know, if you're gonna roll down to the clave, I love what Dr. Phillips always says. You know, 2 or 3 days, maybe even 4 days, 5 days before you get ready to go to the clave. Don't be hanging out, you know, with the bros. Don't be going hitting up all the bars. No, so kind of stay at home so you can decrease your infectivity, if you will. And then once you get there, you know, if we're going to be in place, it's going to be bumper to bumper, brother. We can't avoid that. You know, the social distancing may go out the window. But you know what? If you've not been vaccinated, and I'm not gonna die for that, wear a mask, bro. Wear a mask. Because you know, as Dr. Phillips said, and as Dr. Guyton said, every time there is a big indoor event, despite being fully vaccinated, somebody tests positive. And I think I talked about that maybe about 4 or 5 months ago. It was a big study done over somewhere where they deliberately put all these people in there to see who would get infected, what was the case rate of COVID be. So those are things to think about. You know, I'm checking, and before I go down, I'm going to check the rates of Mecklenburg County, which is where the city of Charlotte sits in Mecklenburg County, and I'm going to look at that. I'm still going to do my best to try to go. The only reason I would not be able to go is because my doctor would tell me I can't go. So those are things to think about. And treatment. If you get sick, it's not the end of the world, bruh. Don't sit there and try to manage it. I'm gonna get, you know, I'm gonna ride through this COVID. Go get the medication. You know, let's be real about it. Go get the medication. You know, we have to do everything we can to stop the spread. You know, we stop the spread. That's a good thing. One other thing I want to tell you about, and I don't think I've talked about this in the past, but there was a study done by the CDC, I think was from December up until April of this year. And they looked at the rates of death, vaccinated versus unvaccinated. 319,000 deaths could have been avoided if people were fully vaccinated. 319,000 people would be alive if they had considered vaccination. So I don't want to dwell on vaccination because I'm not here to beat up anybody about vaccination. But you know, there's a question about you have to show proof of being vaccinated before entering a meeting during the conclave. There are mitigations in place for the conclave. You should be told that by the conclave. I don't know exactly what they are, but I think you can be just like everywhere else. You're going to have to prove you're vaccinated or prove you have a negative test. And then go from there. So I'm going to, speaking of that point, I'm going to yield to Dr. Phillips, who's on the International Health and Wellness Committee. He may have some more information about that than I do.
They probably will be checking temperatures as well. So, you know, they're going to use that as a screening tool. And of course, the regular recommendations that if you are not feeling well, you should, you know, avoid. There was another question just before the one you read, Dr. Boykin, which was if I am in a chapter host room, if I go into that room, I'm going to wear a mask. I'm going to just, Brother Bracey, Colonel Bracey, I'm wearing a mask in that room. That's what I'm going to do. You know, we had a district conference recently in 2nd District, and one of the hospitality suites, all of the brothers that I knew that hung around in that room for a significant amount of time, you know, I think a good amount of them got COVID.
Yeah.
Now, one of my little tricks is when I'm moving around like that, I usually put my phone on an alarm that repeats every 15 minutes. So, because I do believe and feel that within 6 feet for greater than 15 minutes can make a big difference in your exposure. So, you know, I could be having a great conversation with my brother, Dr. Guyton, but 14 minutes, 30 seconds come, I'm going to say, bro, we either got to move on or we could go outside.
Brother Phillips, I want to echo because I am overly cautious and a little paranoid. And I always measure my distance when I'm talking to a brother. And if I'm in a room like we're in the district and I see more than maybe 30 people in a room, if I'm not near the ventilation, if I'm not there, if I'm going to be there more than 15 minutes, I leave. You know, I get in, I get out, and once you start getting to be more than 20 or 30 people, and there's not enough time, another space for me to move around, I really cut my conversation short, and I keep my time. Usually for me, it's about 10 minutes because I'm impatient, one. But other than that, I try to continue to keep moving because I also make sure I wash my hands. Whatever I'm doing, I keep hand sanitizer in my pocket because I truly believe what happened to us in Arizona and my officers were because of touching, because of a confined area, and for me to be around all of them and not get sick, I just kept my hand sanitizer. So the exposure time, ventilated areas, making sure that if you're going to be in those hospitality suites and you haven't been vaccinated, wear your mask. Every session I'm going to go to, I'm going to have a mask on. If I'm not the only bro in there, that's fine. But I'm going to find a place where I can feel the air, because that air circulation can save you from being infected. We found that. That's why when I sit on the plane, I turn my air wide open. And I have a jacket on because I'm blowing that air. That clear air continues to help move the particles around. So just little things, brothers, that I will pick up on being an epi guy, but it's common sense things like Dr. Phillips is saying. If you're going to be there more than 10 or 15 minutes, you need to continue to keep your distance or be ready to move on. Brothers, it's going to be hard. We're going to have a good time in the conclave, but you're going to have to be vigilant. I mean to tell you that when the oil is flowing, you still have got to be vigilant about your health. We're in a time where this enemy that we have can be standing right in front of you and waiting for you to just forget one thing. It'll change your life. So please be vigilant, brothers.
Just to add on what you were saying, Dr. Guyton, I had a brother recently who was at an event, got COVID, and it wasn't that he got extremely sick with COVID because he was vaccinated. He had a cruise that he had set up for more than a year that was to happen a couple days after that trip. And because he had COVID, he could not go on that trip. So there are multiple ways that is still affecting us.
So brothers, let me give you an analogy. Walking through the airport, for me, a public health guy, to hear a parent say, hey, how are you feeling? Keep your mask on. You should be okay. The child was symptomatic, had COVID, but was in the airport with the mask on. The parents are still traveling. So brothers, not everyone is listening to those precautions. You are traveling with people who are not caring about your health. So you got to be very aggressive about your health. I stopped in my tracks. They were passing me, and I just looked back and like, wow, the kid is sick. You're telling the kid to be quiet. They're symptomatic and they're coughing. You want to make sure they keep their mask on, but you're about to get on the plane with 200 people.
Right.
That is the society we're in. That is why we have 83 million infected people, while India, the next closest, has 43 million. We have got to be vigilant. Get vaccinated. It will save your life.
And on that same note, brother Guy and brother Phillips, there's still a lot of misinformation going on out there. A lot of stupid. I'm just gonna put it out there. Stupid misinformation. As a matter of fact, I'm in a particular a support group for a chronic disease, and part of that chronic disease, has lowered my immune status. But thank God I've been fully vaccinated and had 4 boosters. And the question came up on that group: if you have low white counts, should you wear a mask when you go out in public? And someone had the audacity to say, no, that's stupid. Nobody's ever proven that they work. When there's study after study after study that shows that masks are effective in decreasing the spread of it. I didn't say preventing the disease now. I said decreasing the spread of the disease. And one of the ladies on the group said that she went out in public and was challenged by another man because she had her mask on. So, as long as that stupidity abounds out there, and I hope it's not going rampant in our organization, but I know there's some people that don't believe in masking in our organization, but think about it. You might want to get on your high horse and say, I'm not going to wear a mask and you stupid for wearing a mask, but there are people out there like me and others that depend on you to use some common sense to protect us from spreading COVID to us, even though I'm fully vaccinated. When I go to the clave, if I'm going to be around more than 2 brothers, and more than 6, less than 6 feet, guess what? I'm gonna have on my mask. But I will tell you, don't get caught up in this misinformation. If you can't prove it, then don't spread it.
I think another point that, probably, we should probably touch on a little bit is that there's a good chance that there's another booster coming our way. And I think with what you were saying earlier, Dr. Boykin, about how Omicron, especially the newer BA4 and BA5 variants, I think it's important to really recognize, because I know still I'm getting the question of, am I going to have to get a shot every year? So I would definitely keep my ear to the ground and talk with your medical provider about when that's going to be ready.
Yeah, that's a very good point, because right now, I believe it's Moderna has already been doing work on Omicron specific vaccines, and I believe they're about to do some clinical trials of that. Back when Omicron first hit, Pfizer and Moderna, well, more Pfizer at the time, was touting that, well, I'm going to start to work on the vaccine against the Omicron variant, but yeah, Omicron, not the variant, because at the time the Omicron variants hadn't taken a stronghold, and we're just going to knock this Omicron out of the park. Well, BA.4 and BA.5 said, hold on a minute, Slim. I'm going to learn how to evade your antibody producing system, and that's exactly the nature of the coronavirus in and of itself. It came in and knocked Delta out of the park. You don't hear about Delta anymore, because Omicron has become so stealth and so meticulous at bypassing our defense mechanisms. When we had just the BA2, that was pretty good. We could get a lot done against that one. It wasn't exactly 100% or 98% or 50%, but enough to prevent significant infection. Then along comes BA.4 and BA.5, and guess where? Just like the original variant started from South Africa, got over here, now is in every state in the United States. So, I said all that to say this. Yes, I believe wholeheartedly there's going to be a new booster requirement in the fall. I mean, they're already working on that particular vaccine right now, and because we're not controlling this, I think this coronavirus disease is going to be with us a long time, because coronavirus is very, very astute at mutating and developing variants. So, brothers, think about that. Just because you've been fully vaccinated, those of us that have 4 vaccines, you know what? If they come and say, look, bro Boykin, you got to get the 5th vaccine, you say, I ain't mad at you. Where can I get it at? I'm going right down and get my vaccine, because I haven't had it yet, don't want to have it, but I know I have a very good chance of getting it, but I'm still going to go to Clave unless my doctor tell me I can't too. So I'll get back to my brothers with that note.
Brother Boykin, Brother Phillips, the research is pointing to the fact that we will probably have a requirement for a Omicron specific booster in the fall. Please understand that every year, if you're in the military, you're going to take the flu vaccine. Why? Because there's a different variant that they have researched, they have planned for. When now coronavirus is becoming endemic, when you get to 83 million, it becomes endemic, meaning it's going to be something you have to live with and treat on a daily basis. When we start looking at this thing, we got to start living with it. It is going to probably be on your schedule going forward on a yearly basis to have such a shot along with your flu shot. We've gotten that into the society. It's part of our adult schedule of vaccination. So we have got to, as a society, understand we didn't shut it down early enough. It's not going anywhere. It's coming back. In certain instances, certain of our neighborhoods or certain of our countries are going to be ahead of us in treating this because they can lock it down. We here in America, with all our freedoms, are going to have to be more vigilant about treatment modalities and combating misinformation. Understand, that's what we live with now. We're going to have to be that way going forward forever. So do not hesitate when they tell you in the fall that, hey, Omicron's going to be consistently in the air. There's probably a 4th or 5th wave because England is dealing with the wave right now, and other European countries are dealing with waves. I just got to notice that a country I just came from got and just made the top 5. So what I did when I got back, I quarantined 4 days. I tested myself, but the numbers are still out there. In some places, they're still rising. We have 4 vaccines that we can take. Go ahead, brother.
No, I was going to say, go ahead. But I was going to say, let's talk about testing, because I think that's something the brothers need to understand for the clade. My recommendations are, and all the 3 of us have talked about this before on this particular call, is that you should get a PCR testing, if you can, no more than 72 hours prior to going to the conclave. If not, at least get a rapid test within 24 hours before going. Now, that's a good plan that you can do to go there. When you get back, I would suggest, if you have not been exposed or have no known exposures or known cases that you were around, still consider testing yourself within probably about 24 to 48 hours after you get back. If you've been been exposed, we now know, and you have no symptoms, we now know that it's recommended you test yourself no later than 5 days post-exposure, because you should be in quarantine those 5 days and test yourself at that particular 5th day to see if you're positive or negative. If you're negative, you can come out of quarantine. If you're positive, then guess what? You got to do the whole thing about the whole COVID treatment thing. If you're asymptomatic, people ask me all the time, well, I'm asymptomatic. I really don't have that big of a symptoms. Should I really go get the oral treatments for COVID? Well, that's on you. I would recommend that they're out there. They're free. But you do have to have a prescription for them, but they are free. You can go any place you want to and get those oral agents free of charge. But you have to have a prescription from a healthcare provider who's licensed to prescribe such medication. I don't know if you've seen that situation in New York, Brother Phillips, about people saying, well, I don't know if I should finish the medication because I feel better, or I don't know if I should take the medication. Please don't do that, brothers. If you start a medication, finish it. We want to speak to anything about that, Brother Phillips?
No, it's like the vaccination. How many people have you seen? Yeah, I got my first shot, but I didn't get the second of the primary series, or I got my primary series, I never got my booster, or I got my primary series, I got my first booster, but I'm eligible for the second booster. I don't think I'm going to do it. Or I got all my shots and I'm not going to get my kids vaccinated because I'm not sure. So unfortunately, you've got many layers of people being incomplete in how they're finishing this out. I think another thing I would just go back and add to what you were saying, Dr. Boykin, is if you're going to do a rapid test on your return and say that first one is negative and you're asymptomatic, make sure you repeat it in 24 to 48 hours to ensure and confirm that negative test is actually what it is. So I would definitely recommend that. I have had a patient already that called me and said, well, I feel better after 3 days of Paxlovid. Do I need to take the other 2 days? Because unfortunately, it's a couple pills with it. And I've had some people in taking it complain about some indigestion symptoms. So as quickly as they feel in their medical opinion that they can stop, they want to, but fortunately in this case they called and asked a question, and I was able to stop them before they made a choice that might have resulted in them having a resurgence or a re-exposure or what have you.
I think a lot of people, you're talking about I'm fully vaccinated, but I ain't gonna get my kids vaccinated, and some of them might result from the fact that when the vaccines were first rolled out last year, it was a haphazard way it was rolled out, like it was rolled out to healthcare providers and then to the essential workers and so forth and so on. But the good news is when the pediatric vaccines are on, you ain't got to worry about that. You don't have to worry about that. There's a plan for that. But, we already had almost 75 million doses before it was even approved, standing and ready. And the president said that he was going to make sure that kids got it. And he used different things. Let me see what he said. He's going to make sure that the PCPs got it, the primary care people got it, approved pharmacists, community health centers, rural health clinics, children's hospitals, public health clinics, and other community-based organizations have these vaccines ready. So no kid will not be denied access to the vaccine. So that's no longer an excuse to say that, well, I ain't gonna get it because they ain't gonna give it to my kid anyway because I'm Black. No, that's not gonna be the case. We're gonna have WIC programs are gonna be voices for that. Head Start's gonna be voices for that. Maternal, infant, and early childhood home visits. These people that come to you will have it. HUD programs, Medicaid, and children's the CHIP program. As a matter of fact, we're using Black community-focused organizations like W. Montague Cobb Health Institute, which is going to is going to host health and wellness and vaccine clinics. So, I mean, if you're using that as an excuse for not to get your kids vaccinated, don't. Because I just sit there and told you all the things you can do, all the places you can have. You know, we're going to make sure, well, now I'm going to make sure, but the government's going to make sure that you go to a place that you're familiar with to get your child vaccinated. So no longer an excuse saying, well, I don't go down there because they don't treat us good anyway. Well, right in your own neighborhood, urban center, you better get your kid vaccinated. Your school can give your kids vaccinated if they're over the age of 5. So, you know, don't do that to your kids. As I said earlier, you've got kids, you come to the clave, and your kid's sick, guess what? You might be spreading COVID. So if your kid's eligible, please consider getting them vaccinated. And I'll yield back to Brother Guyton. I think you had something you wanted to say at that particular point, Brother Guyton.
So I really want to make sure that we understand that there are enough free testing assets that you can obtain from the United States Postal Service is one of them. I think you get like 8 tests. Brothers, if you have those tests, I saw a comment in the chat, bring those tests with you. I'm bringing 4 boxes, which may be about 16 tests. You know, I'm going to be with my chapter brothers. I'm going to make sure that they're hanging around me. You know, they're going to be tested before we drink and have a good time. If you can't, then I can't hang around you. We're good. I love you, bruh, but you won't be within 6 feet of me for more than 15 minutes. So I am going to be vigilant. That's how I'm traveling. I want to, you know, just make sure the brothers understand about vigilance. We're taking vacations now. Just because you're going to a tropical place with a lot of sun does not mean that you can let your guard down. The Dominican Republic right now is a hot spot. Greece, Hawaii, they are hot spots for COVID. So be vigilant on your vacations, because remember, you got to travel through 2 airports or 3 airports to get to that sand. So please understand that be vigilant in your travel, be vigilant in your testing, and hold those around you to that standard of, bro, let's be safe and let's party safe. I know it's going to be hard, so you need to get to them before they get the oil in them, and make sure you have enough tests. That's a great idea for every suite to have testing that's available for those that are going to be there for a prolonged period of time. That brother that's going to drink the whole bottle of Crown that's going to be there all night, test him. Make sure you test him first. You know that one chapter that's going to do that. Test him first.
Yeah.
Out of your back, brother.
You brought up another good point about travel, because, I'm going to hear a lot of people say, well, you no longer is mandated to be masking on planes. You're no longer going to have to be prove vaccination if you come from a foreign country, but has some caveats to it. Let's talk about the travel and vaccinations. You don't have to have a positive, prove that you have COVID or vaccination if you've had COVID in less than 90 days and have a test. If it's been more than 90 days and you've had COVID or you haven't been vaccinated, you're going to have to prove it, especially in your vaccines. You have to prove it. So, just because the court struck down the mandate for wearing masks, the airlines still have the right to require you to wear a mask. So don't get into the airport and say, well, the court struck down this mandate for wearing masks. Well, the airline has a right in their own way to make you wear a mask. But brothers, don't make a scene if you go to the airport and they say masks are required. Regardless of the community transmission rate, that airline has the right and the authority to make you wear a mask if they so choose. So,
well, I would just add to that. I'm sorry, upset. I would add to that. I traveled to Panama a couple months ago. Panama has a 96% vaccination rate in their country, and everybody wears a mask. Even when you're walking down the street outside, they wearing a mask. So you go there if you want to and don't wear a mask, and you'll probably get stepped to by one of the natives.
I can tell you one of the biggest issues for me traveling were the countries that I traveled to. Their rates, some of their rates are lower than ours. And guess who is the risk? I'm introducing risk to their country. So, bros, be vigilant. Test. If you're traveling, test when you come back. Because these restrictions are being raised, COVID is not disappearing. And I have to say that we've been through this fog for over 24 months. It is not going anywhere. You want to enjoy your vacations, but you got to travel differently now. You got to think differently. We've got to act differently. Again, get into the sandy beaches. We need that relaxation. But understand, the hand washing, the masking, get vaccinated, stay tested. Those are things that you need to consider and always have in the back of your mind. I know we want our freedoms back. I know it's big about that. I also, when I'm on a mass transportation bus or anything, I wear my mask. I have my hand, especially on the buses, especially on the trams, because it is such a tight space and it's always transit. Someone's in and out. I'm careful. I always wear my mask and I wear and I wash my hands with my sanitizer. The only time that I may remove my mask, if I'm in a great hall and I got plenty of distance and there's no one near me, greater than 6 feet, I'll take it off. But the minute I know there's a crowd coming near me, my mask is back on, and my hand sanitizer. I'm very careful.
I'm getting so used to wearing my mask, but that sometimes I get in my car and realize I still have my mask on because I got so used. If I run to the grocery store, people say, "Well, you just run to the grocery store," but guess what? It's the unknown that you don't know about. You don't know who in that store. You don't know where you've been. We talked early on about the droplet effect of coronavirus, and that's why you hear us now talking about a well ventilated room. You can walk down. You don't know who's been in the aisle before you and coughed and sneezed and whatever, and you run right behind them, and the droplet's still hanging in the air, and you get it, and you have no mask on, thinking you don't have to wear a mask. Well, I say to you, brother, do what you want to do. But look at your transmission rates again. Let's talk about that really briefly again. If your transmission rates are yellow, it's your choice. It means, green, it's your choice. That means it's a very low transmission rate in your community. If the transmission rates are yellow, which is moderate, if you have an underlying disease or you're immunocompromised, you should wear a mask. If the transmission rate is red, which is high, regardless of your vaccination status, your immune status, or your underlying health status, everyone should wear a mask indoors if the community transmission rate in your area is red. So that's what we talk about having to plan, checking your transmissions before you go. If you come from an area of high transmission, please consider wearing your mask when you get around the other brothers, because you may not know that you're a carrier. You may be asymptomatic carrier. Even if you're vaccinated, you may carry some of the virus in your stream. If you're definitely unvaccinated, you come from a high stream area, you could be an asymptomatic carrier. So let's think about that. These are all the things we're trying to prep, brothers prep for the conclave, because I know a lot of brothers have said to me, especially after our second district meeting, well, man, we had such an outbreak of COVID. This really seals my plans about going to clave. I'm going to go ahead and get my refund. But you don't have to do that, brothers, because this is, as Dr. Phillips and Dr. Guy said, this is going to now become a reality. COVID's going to be with us. I don't know what the seasonality of it's going to be, but I do know when people gather in large places, we're going to see these little spikes, these little things like that. Why do you think we always vaccinate people in September with the flu vaccine? Because we know it's going to peak in December and January. And we still vaccinate folks for the flu all the way through the month of June. At least I did in my practice. I think some people are still doing it. And remember, when the H1N1 flu outbreak happened, when was it? Summertime. When was it? Summertime. So you can't say that, oh, it's summer, I don't have to worry about COVID, because COVID don't care whether it's summer, winter, spring, or fall. If you're vulnerable, you're going to get it. So, brothers, I agree with what has been said in the chat. I would consider having test kits, gloves, or whatever you need to do. One thing you certainly should have in your suites, I would consider, is a mask. I know brothers are gonna be eating and brothers are gonna be, drinking and things like that. Well, it's like at a restaurant. You gotta take off your mask to eat. You gotta take off your mask to drink. But if you're not eating and drinking, consider putting your mask back on. It's just a simple thing to do. You can still talk. You're close up to each other. If you're with Dr. Phillips, he ain't gonna stay with you long enough in 14 minutes. I'm just telling you, if you think he's being rude, he ain't being rude. He say like, hey, bro, I'm done. My timer went off. I'll catch you on the rebound. So, I have a top to that same situation too. Because we've done this thing so long, brothers. We've been on these calls, and at the second district conference, the first time I got to see Brother Dr. Phillips in person. and it was a great memorable moment for me because I really enjoyed it. I mean, Brother Guyton is my chapter brother, so I've seen him before. But Dr. Phillips, I just met and we hung out. But you know what? Like he said, we didn't stay in one place too long. We moved on. And I just followed along. And after a while, he'll tell you that. After a while, I said, yo, dog, I'm gonna catch you tomorrow. I'm about to, I'm about to leave. I'm about to go back to my room. I'm done for the night. So just things like that, brother. So anything else you want to bring up? We kind of get into that time, getting close to the end there. We got a few more minutes before we have to go, but
I think I would just say before we let the tail end take us out, I just think that you got to have a plan. That's all I'm saying. Have a plan of action. I think again, some good ideas, especially if you're hosting a hospitality suite, is having some hand sanitizer, having masks, doing rapid tests, especially if you want to maintain the safety of that space. We've got 3 weeks till the clave. Got time to get the booster in if that's what you are due. And it takes about 2 weeks for it to kick in. If you haven't completed or started your primary series, it's not a bad time to get your shot now. But again, don't sit back. Gotta stay doing. So with that, I'm going to yield a 91.
Hey, bros, quickly, if you are and know of brothers heading to the conclave, get with your chapters and you devise your plan. You want to make sure those brothers either have been vaccinated, have been tested prior to departure, or you have the capability of testing them in your chapter suite when they get there. Travel with a plan. Brothers, it is upon us to continue to provide the information, to continue to be our brother's keeper as we move forward. Conclave is going to be a great event, but we got to party smarter. And to do that, have a plan. We have time to make that plan. We got about a good month. Next chapter meeting, make sure that you speak to those brothers who are going to the conclave. I know we've gathered a list here in LGG, and that list is complete. And one of the messages we put out, brothers, make sure you're vaccinated. The next message from me is going to be make sure you're vaccinated. Make sure you are tested. Make sure you take tests with you. Make sure you have masks for our suite. Those things will happen. Will save, help us with the infection rate. Again, if you contract COVID and you're vaccinated, fully vaccinated, you have a 95 to 99% chance of just having slight symptoms. Get vaccinated. It's the best way to save you from hospitalization. And the last thing you want to do is be intubated. And to prevent that, get vaccinated, brothers, and have a plan. Again, it's been my honor to be here and be the tail for 88 and 78. 78 and 88, we'll be partying together only 15 minutes, but we will be together.
All right, my dear brother. So I'm gonna take us out. As you heard from, I'm gonna say my piece. I'm gonna give everybody one more minute to say that last piece. But as you heard from our brothers, the conclave is not an event that you have to miss because of COVID-19 running in the community. Have a plan. We've said, all three of us have said this all night. Have a plan. And my personal plan is that I reduced my going about, because I don't work, I'm retired. I reduce my going about 3 or 4 days before I'm going to a major event like that. I do my test. I test myself before I leave, at least 24 hours before I leave. And I test myself 24 hours after I return, and then 24 hours later after that. I am fully vaccinated. I will not be on that plane without my mask on. And I'm not going to be intimidated by people who try to tell me to take my mask off, because I'm not going to be a victim of misinformation. Because misinformation is what's killed a lot of people during this pandemic. People that would otherwise be alive, and people that died after they realized that was misinformation. So brothers, protect yourself, protect others, have a plan, and get ready to enjoy a great conclave. 88.
Hey, when the point of the spear pierces, ain't much more that needs to be said. I think, again, the catchphrase for the month of July is, what's your plan for the clave?
Brothers,
91.
As we know, the 12 Ps, let's prepare. Okay? Have a plan in place. work with your chapters to have a plan in place for brothers traveling to the conclave. Those that you know that are registered, make sure they have a plan in place. That's the biggest thing for us right now. Is it's going to be a big event. It's been a year, 3 years. Let's get there safely and let's come home safely. Over.
So once again, we thank you for attending our monthly webinar. We'll probably be back next month with more information for you. But I say to you, the opinions you heard tonight do not represent those of the Omega Psi Phi Fraternity Incorporated. Rather, the three of us, our own opinions. But our opinions are based on factual data and not misinformation. So please enjoy the clave, prepare for the clave, and as Brother Ampofo always said, consider donating blood if you can. So brothers, have a good evening, and we'll see you next time.